COVID hospitalization rates are continuing to drop across the country as the U.S. loosens many COVID protocols put into place over 2 years ago. But experts are concerned the damage has been done. Many fear COVID has permanently altered the healthcare profession, from burnout to PTSD. Doctors and nurses are struggling to continue their work in hospitals. And this all comes, of course, as new COVID variants quickly become dominant strains, raising concerns about a new wave in the near future. We want to check back in with Dr. Richina Bicette. She's the medical director of the McNair Campus Emergency Department, somebody that you probably recognize because she's joined us a number of times over the course of the pandemic and is a friend of the show. Doctor, good morning. Thanks for being with us. So, first off, it's been more than 2 years since COVID was first reported in the U.S. During that time, throughout these 2 years, we've talked to you about the strain your hospital has been under. At the time, like many hospitals across the country, the fatigue, the burnout your staff was feeling. What do things look like right now? Are you even close to back to normal at your hospital or seeing different challenges come up now that we're kind of past the peak?
Absolutely not, Savannah. It's actually interesting to see. COVID numbers are way down. We're seeing the lowest hospitalization rate since the Department of Health and Human Services began tracking hospitalizations in 2020. Yet still across the country, hospitals remain 80% full. So although COVID numbers are going down, people are still coming in ill with other sicknesses, strokes, heart attacks, accidents, gun violence is at an all-time high. It's like we've been running at a full sprint for 2 years, and there are no other staff members to tag in for us to get a break.
So, Doctor, looking ahead, as these COVID variants circulate and people do still come down with COVID, like Omicron, now this XE variant, tell us what you're seeing with those patients. Is that increasing, and are they any more difficult to treat? Or, we think back to the beginning and we were talking so much about respirators and there not being enough beds. What is all that like now in your treatment?
Well, personally, I find that in my emergency department, I am getting more patients who are incidentally found to have COVID, as opposed to people who are coming in with COVID symptoms and then positive. We are seeing right now about 25 to 28,000 cases per day in the United States, which is extremely low and the lowest case numbers we've seen since last summer. However, treatment is becoming an issue as new variants begin to emerge. Monoclonal antibodies are no longer a staple of outpatient treatment, as it seems as if they are not working against this new variant. There also have been some oral antiviral medicines like Paxlovid that have been approved for use, but we're not seeing that employed too often because there are a lot of medication interactions, and it's only approved for older adults who are at risk for severe disease.
Now, we've reported extensively, and I just mentioned the burnout doctors and nurses are feeling because of the pandemic. So first, I'm wondering, how are you doing? How's your staff doing at this point? And what you see for the future of the medical field?
It's really hard to say, Savannah. I do know that for a lot of physicians, there have been some people that have abandoned bedside clinical medicine to pursue other avenues and other endeavors because at one point it just became too much. Even when we see COVID numbers start to decrease, we've been here before. And although the saying is what goes up must come down, we've seen with COVID cases that what goes down can actually quickly spike back up as well. So we're constantly on a state of alert, and that's a very stressful situation to be in mentally, physically, and emotionally.
I mentioned at the top of this, Doctor, that in some ways people are concerned that the medical field has changed permanently. Do you feel that way?
Absolutely. Absolutely. We will never be the same.
Absolutely. Dr. Richina Bicette, thank you for joining us. It's so great to have you with us, and thanks for sharing the experience you and your staff are going through.
Thank you, Savannah. Have a great day.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.